It's real quiet. It's like real quiet. Y'all like real
real quiet. Well, bring the noise, King. Bring the noise.
It's almost too scary, the quietness.
Bring the noise. Hello, everyone.
How's everybody doing? How's everybody doing?
Yes, that's what made you the host, so you can
well, you know,
put it live to it.
Okay.
Hello, everyone. Hey,
hello. Hey, hey, Judy. Hey, Deborah. Hey, Rhonda. Hey, Katie.
Hi.
Hey, LaWanda and LaStor. And is it Ifunanya? Or Ifunanya?
Oh, you did good.
I had a lot of practice. I've been practicing for years.
But do not ask me to try any of that. I know William.
Thomas, some kind of way I got out.
Welcome, 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 everyone.
Help me.
We're going to get started here in a second. King is going to
get
us pumped and started. And I'll be co-hosting.
Please.
Anytime that we can come together and have fellowship, especially when it's a move where you're actually loving thy neighbor. I mean, you can't go wrong, baby. You cannot go wrong. And so, dialogue is always the best. God said because of lack of knowledge. And so I expect to, spread a lot of knowledge so we can save a lot out there.
Yeah. Absolutely. I agree. I'm so glad to be here today. I hope everyone's doing well.
Yes.
On this Thursday evening or pre-evening. It's 4 o'clock Central Standard Time. As more people come in, we welcome you. We welcome you. I'm Martine Corte. I'll be co-hosting. I'm going to have King's back. I'm going to have his back during this wonderful fundraiser event. I'm so excited. Thank you so much, Judy, for putting this together and all of your team to help you put this together. We're going to have a good time these next couple of hours.
Yes, without a doubt.
You're welcome. You're welcome.
We're gonna let a few more people come in, and then before we move into to the agenda for today, I know we're gonna be introducing some of the board members that's helping Judah out in this mission, and so we want them. We'll hear from them. Also, we will be hearing from Judah herself, and we're gonna ask her. We're gonna get all in her business. We're gonna get all in her business. We're gonna be asking her some questions. Yeah, without doubt. So here you can spread rumors here. It's okay to spread rumors here. You know what I mean? Go ahead and spread rumors. You know what I mean? So anything you hear, go ahead and tell it. You know what I mean? Gossip as much as possible. Because we want to make sure that we create awareness. About this, this form of cancer, and especially since on a different level than other ethnicities. We have to bring awareness. God said we destroy because of lack of knowledge. Our goal is to bring as much knowledge so we have the least destruction as possible. So hopefully we'll be able to put a smile on your face, but get some knowledge at the same time. I will be messing up people's names, so I'm so in advance. But that's why I got my co-host, Miss Martine Corte. She got look at her last name, Corte, and so.
And I still pronounce it wrong at times.
Yeah, so
we're welcoming everybody in. People are still coming in, rolling in. We got Abby, she's just rolled in, and Father is it Vitalis, and MJ is in the house. Okay, MJ, I see you.
Okay.
Oh, we got a nice little crowd here. That's nice. They're still rolling in.
Okay, we got a Reverend. Is that the one Reverend gonna be praying for us? I need some prayer, Reverend,
Father.
right now. I need some.
Father.
I'll be happy to do that.
Yes, that's Father Vitalis.
Yes.
Welcome, Father Vitalis.
Thank you very much.
You're
Okay.
welcome. Welcome, Naomi. And Johnny just is coming in. His audio is coming through.
Okay. Everybody looking good. Y'all looking sharp.
Yep.
I took a bath, especially for this occasion. I mean, I took a long hot shower just for this occasion, y'all. So
I hear you.
Everyone's looking fresh and so clean.
Yeah, without a doubt. And then, as we wait for everybody to come in, I'm just gonna kind of, give some background. We're gonna, of course, do a greeting to all the board members, those that are supporting Judith in this mission. Also, we're gonna give a PowerPoint. I think Judith's gonna do that because I didn't prepare, so somebody gonna do it. And so Judith's gonna do the PowerPoint. And
Why me?
because I guess because I'm I got bifocals on. I know I look young, but I got bifocals, man. Let me take these things off. Okay. Also, if you hear a voice in the background, I am at the airport, and so every once in a while you might hear something in the background. But I'm doing double duties. I have to go cover a fight tonight. Well, cover a fight this weekend. Find out about 6 o'clock. So my co-host is going to be taking over for sure around 5:30. I got to board a plane, and so actually I'm gonna let the whole airport into our Zoom call, baby. The whole airport is in our Zoom call, and so we got a captive audience. Again, we're gonna have a background of the foundation by PowerPoint. And then we'll have a tour of the website also. So just kind of give you guys an overview of what's going to be happening today. Of course, we're going to have some questions and answers section, video, slideshow. And then, of course, we want to hear from you. I mean, some of you guys have your own experiences, but so we want to hear why you're supporting Judith to create more awareness around this issue. So I'm happy to be here. Also, I feel very, very blessed to be asked, without a doubt, and to have this is we got many cultures on here, and ethnicities and genders, and we got the pastor to keep us in line, and so we got the full gamut. So I really appreciate the diversity that I see. So we appreciate you, ladies and gentlemen, coming today. Martine, you have anything?
Yeah. Hey, I just still want to welcome everyone that's rolling in here. Sammy has joined us. Hi, Sammy. Welcome. Again, Naomi, MJ, Lawanda, Lasor, Katie, Ifananya, Drissa, Abby, Father Vitalis, Rhonda, and Johnny, and Deborah, and Judy. So welcome everyone to this fundraiser event. I'm so excited to be co-hosting this evening in support of King William. He's King William today. Oh, where's your crown at? Remember, you're supposed to wear your crown. King William. So just thankful that everyone here has made it. We're going to have a fun 2 hours, and we're going to start off as soon as Judy gives us the go ahead. We're going to have Father Vitalis lead us off in prayer. We never want to start anything without prayer, because that gets us set on the right track. Amen. So definitely we want him to get us on the right track, and then we know for sure that we're going to have a wonderful event, wonderful fundraiser. So I'm just glad everyone is here. I hope you guys are healthy, you're feeling good. Get your water, get your drinks. We're going to have a good time. Get your snacks, whatever you need for these next 2 hours so that we can be comfortable and have a good time and be able to learn more about this disease, multiple myeloma. So Judy, whenever you are ready, we can go ahead and get started. It's 4:11 p.m. right now, Central Standard Time.
Yep, we're ready. Father Vitalis, lead us in prayer to start off everything.
Well, let's take a moment and remember that God is with us already. So we are just lifting our hearts before the Lord and ask Him to bless us this evening at this meeting and this celebration and this recognition of what God is doing in our lives. Lord God, we thank you and we bless you. We ask you to be with us this evening as we deliberate, as we think, we pray, as we brainstorm, at the same time get to understand how best to serve our community, our neighbors, especially those who are sick. Lord, in your mercy, we ask you to bless this gathering, bless this initiative that our sister Judith began. Bless those who support this initiative. Bless those who will benefit from the good work of this foundation. Bless those who can be inspired so that the work that is being done through this foundation may not only bring life, renewal, healing, grace, and comfort, especially in time of distress, in time of suffering, in times of pain. Good and loving Father, you made us to know you, to love you, and to serve you. So be with us tonight, be with us always, so that initiatives and ideas and fundraisings and all the materials or things we need to advance this cause that will bring comfort and healing to those who are most in need may be possible and available. Father, we ask you to bless and reward anyone who contributes in any way for the growth of this foundation and for the good of the beneficiaries of this foundation. Loving Father, we are yours. We belong to you. You will always be with us. And yet, we have to go through these difficulties of pain, sickness, and suffering. But we know that you love us and you made us, and you want the best for us. So we ask you tonight and always to be very close to anyone who is suffering from this disease, anyone who is taking care of those who are suffering, and anyone who is just fatigued and tired and looking for a way out. Loving Father, please be with them. As we pray for them, we also pray for our nation. May healing begins with the new election, with the new government coming in place. May agencies, government bodies that will, in any shape and form, help advance the cause of what is good, may then be able to do so. May you inspire them and inspire all of us in this chat room or Zoom call, and those who may not be able to join us today. So collectively, in any way possible, we can do what is good for our community, for those who are in most need. And most of all, that we may do that with charity, with love and forgiveness. We ask all this and many more through Jesus our Lord. Amen.
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 Yeah, I don't want to.
Thank you so much, Father.
Thank you.
I don't want to crack no joke on the Father. That was a long prayer, Father. Boy,
That's all right.
hey, if I ain't blessed with that one, boy,
It's
I'm
good.
known.
It's for good
I'm
cause.
known. I'm gonna be blessed with that one, baby. I want to be blessed with that one. I'm about to get on this plane, so I'm gonna be flying real smooth. I do want to take time out to the board members. I want the board members to give a chance to introduce themselves. And so we can go one at a time. Maybe go alphabetical order. I don't know how we want to do this. I don't have a coin with me, but I would love to hear from the board. I have never seen the board before. I'd like to hear how who you are and how you got involved with helping out in this mission. So who's first?
I'll start. My name is Katie Bruno, and I am an advisor with Raymond James. And I met Deborah, actually, a couple years ago, and she introduced me to Judy when she was launching this foundation. I serve as a secretary and am responsible for having orderly meetings and making sure that we get our follow-up done. And I'm looking forward to being on this journey with Judy as we launch the foundation. And want to thank all of you for being here and supporting the foundation.
Appreciate you, Katie. Hopefully, you keep us orderly on this one also. Who's next?
I think that should be me. Is that correct? In A alphabet, is that correct?
Yeah. You Visalis. Well, you know,
Yeah.
we can go from A to Z. That's
Okay.
fine. Or V.
Okay, I think I'm A, but okay, no, I'm last then by Vitalis. I'm last. No, that's not me then. I skip.
Hey, we yield to pastors now because you work for God, baby. We yield to pastors.
Okay, I'll go ahead. Father Vitalis, as you know, I am from Nigeria originally, and I've known Judy for a couple of years now. And as you know, Judy, I'm sure it's a very personal note for her to begin this foundation. And so when she told me about it, I was very excited. First, I've always take pleasure and inspired when a Black woman wants to do something. It's something very special, especially in the culture where we're coming from and knowing the challenges that this illness has on our people. So when Judy proposed this foundation, I thought it's a great foundation to support, knowing fully well that I work as a priest. I've known many people who have gone through tremendous difficulties and not getting enough support. So when Judy brought this proposal on board, I was very quick to say, look, sign me up, whatever I can do, I will be happy to help. So I don't have any special skills or any special expertise. I don't know. I'm just available on the board and to do whatever they ask me to do. And I'm sure with Judy and Katie and Debbie, they have very sound knowledge of what to do. So I kind of tag along, and I'm happy to support the process. And I really want to see the foundation grow and impact many people, because I know for firsthand many people who have suffered the disease or the illness, and my heart reaches out for them. So in any way we can support, especially in the minority community where I'm coming from. So it's kind of very special, and anything we can do to highlight or to support, I'm happy to do that. I am the pastor of St. Benedict de Moore Catholic Church on 24th and Grand Street, just close to 24th and Lake in downtown almost. So I joined the board when I was both the pastor of St. Benedict and Holy Name. But right now I'm just only for St. Benedict. So I'm just happy to be on board, help out in any way I can. That's much I do.
Okay, well, Pastor.
Yep.
I do want to say thank you. One morning, our radio station is right next to St. Benedict.
Yep.
And one morning, y'all was playing the National Black Anthem. And I looked out, I said, dang, that's the National Black Anthem playing at the church. I said, well, the church is moving over there. Yep. So, well, we appreciate the music. We appreciate the rhythm, the spirituality that you give to the community.
Thank you.
Who's next?
All right.
I can go.
Okay.
My name is Deborah Dogba. I'm the organizational and development strategist. I've known Judith for 2 years now, and we started off as her being my client and me being her consultant. And everyone that knows Judy, you know, she's very smart and strategic. And she was able to convert that into a service. Now I'm serving on her board, and I'm glad to do that. She is very determined to make this work, And I encourage everybody to support her. This is a good cause for anyone that has been affected by the disease, and her doing so, it's also in memory of her late father. So it's dear to her heart, and I like to see, I believe Judy's sister and brother all the way from Nigeria, if I'm not mistaken. Johnny, glad to see you
Yes.
finally.
Yeah, same here. Hi.
My mom wasn't able to join. She's staying with my sister. I don't know, maybe she's in attendance, but I can't see her. She probably hearing what we're saying. So she appreciates everyone being here. And she told me I'm going to say a rosary for the event today. So thank you guys for being here. All
So,
right.
we actually got someone from Nigeria online. All right, shouts out Nigeria, Africa.
Yes.
Wait.
Yeah, my brother from Nigeria, Sunday.
Shouts out, big brother. Without a doubt, big brother. Be quiet over there. Who's next? We got any more board members?
Yes. Sustain, do you want to go next?
Sure, I can go. Can you guys hear me?
Yep.
Yes.
Yep.
Awesome. And definitely you heard her call me Sustain, and this is the name that I'm known mostly by. That's my middle name, and it's a Christian name. Otherwise, my first name is Lasur, and you can see it on the screen. Middle name Sustain, and last name Compaore. I am from Burkina Faso, formerly called Upper Volta. And I've been in the US since 2007, and I've known Judith maybe about 3 years ago, and I met her at a common friend's wedding. We were in the team planning the wedding together. That's how I met her, and since then, like Deborah mentioned, it becomes a good relationship that is thriving. I was contacted a few weeks back about uh, me being needed as a treasurer for the foundation. I wasn't sure what I needed to do and if I needed to join. Took me a couple of time to think about it and make my mind. And then I confirmed with her. We got to meet face to face and chat a little bit about it. So fast forward, here I am sitting in front of you as the official treasurer of the foundation. Looking forward to working with the whole team on the board and with everybody here or not here tonight, on the board or not, as long as we all use hand to make the goal and work of the foundation successful. So glad to be part of this new adventure, ready to learn and ready to grow.
All right. Well, we appreciate you handling the money. We appreciate you handling the money. Without a doubt. Any more board members on the call?
I will go next, and by going next, I mean I'm going to take permission from the rest of the board that are absent. They say they wish they could be here. They have something tied up at the office. So they send their greetings to say thank you for joining us today and for carrying this great initiative. So I know everyone is busy, but we want to say thank you for joining us today. And if you don't know, I am Judith that we are talking about. So I am Judith, originally from Nigeria. So you you all will hear, have heard a little bit about how the foundation started. It started after my dad passed away in 2016. So I found the need of having the disease, which is multiple myeloma, known to the community, because most people don't know what it is, and they don't know the symptoms, the right treatment, and how to go about asking for the right information. So my board members are the ones that I approached when I wanted to start a foundation. Deborah was the first person I approached and told her about my idea of starting this foundation. And I'm glad that she worked with me, set up the plan, the vision and mission, everything. She led me step by step. She followed me all the way till today. So I'm glad that she gave me the support to do what I wanted to do, because I didn't know where to start. So her being in the business and being a consultant, she has worked with a lot of non-profit and a lot of business people. So she gave me the idea on how to start it. I want to thank all my board members, Father Vitalis, for, I can't thank him enough for all the support and prayers that he has endured to me and my family during the hard times after my dad passed away, and also taking my dad's body back to Nigeria. Also thank Katie for accepting to be my board member. I was introduced by her through Deborah. And from there we have formed a friendship from that, being my board member, and also develop some friendship through that as well. And also have to thank Lustra. I know I call him Could Sustain because that's the name that I know him with. So I knew him from my girlfriends, like he said, through the wedding. So he has always he's somebody that when you need advice, when it comes to anything about tax, he's the go-to person. So I have formed, he's like a family to me because my girlfriend is a family. So he's like a family to me. And also I know the wife as well, and the kids, adorable kids. So thank you all for being here today. So like everyone say, I'm the founder and the president of the foundation. I appreciate everyone being here. I hope you guys will learn something and get the information out there in case if anybody need help, let me know.
Okay, great. We appreciate all the introductions. Appreciate all the dedication of being on the board. I know everyone have busy lives and stuff like that, but God gives us, pay us tenfold when we actually love our neighbors. And so we appreciate you guys loving your neighbor without a doubt. Let's continue to move on with the agenda, and let's focus on the background of the foundation. And we have a PowerPoint that's going to be presented.
All right, I put myself on mute. Yes, that will be me.
Okay. See, I'm glad I don't have all those responsibilities. The pastor got the prayer, Judah got the, and then Louser got the money going on. Katie got us make sure that we're in line. And so, everybody got responsibility. Miss Williams, you kind of quiet over there, Miss Williams. Miss Williams, you ain't said a thing over there, Miss Williams. What's going on with you, Miss Williams?
My name is Rhonda Williams, and I'm just a spokesperson. Judith had asked me to speak a little bit on my mom. Unfortunately, she passed away on the 11th of September from IgA multiple myeloma. And I'm just here to speak a little bit on her behalf and let everybody know some of the symptoms and some of the treatments that she endured. And she never complained about anything. And she was on a journey. And so I'm just here.
All right.
Thank you.
Well, we appreciate you, Miss Williams.
Thank you.
Yeah, thank you for being here, Miss Williams. She's going to talk more about her mom and the experience going through, having to care for someone that has multiple myeloma. So you all can hear and hear her story as she shared the journey caring for a parent that has multiple myeloma. Okay.
Ooh.
All right. I will. Can you all see it?
Not yet. Hold on a second.
Not
How do you-
Not yet.
Well, until she get that up, we do. Since you've been talking, Miss Williams, can we hear more about your mom? Because I started my morning show after my mom died, and so that's the way I grieve by telling her stories Monday through Friday with my co-host Martine, and so give us some knowledge from your perspective, from your experience of what we should be looking out for.
Okay. This is my mom.
Okay, all right.
And her name was Eliezer Arnice Williams. She was a strong woman of faith, and we belonged to St. Benedict the Moor with Father Vitalis. She was diagnosed in May of 2011 with multiple myeloma, and they found it. We had just left Mass and was on our way to the grocery store, and we were in a car accident. And she complained of her right hip or right groin area hurting. And so we ended up, of course, going to the hospital and getting her checked out, and they saw white spots. And, nobody had ever said anything about white spots. And my mom, being a retired LPN, she kind of knew what the white spots were. And so then she was sent to an oncologist who said, yes, she did have cancer. And what she ended up having was called IgA, multiple myeloma. And they said that it was very uncommon in the African American community. And so they had tried a lot of different chemos, and they kept saying that my mom, she was one of a kind, because every chemo that they thought would work did not work. And she ended up having to have a plasmapheresis about 5 times, which is where they go in and they take out the plasma and exchange it and put in artificial plasma. And a lot of times my mom was very ill. I've been with her when she rolled from one side of the bed to the other, but she didn't complain. They had her on a lot of different chemos, Darzalex, Revlimid, which ended up giving her a lot of hives and rashes. She ended up having to take Solumedrol just to kind of help relieve some of the pain and some of the side effects. Let's see. She ended up, when my mom passed, her myeloma had gotten so bad until it had ate through her bone. And so she ended up, it had metastasized into the soft tissue into her stomach. Unfortunately, they had first told us in the journey that she had began was that it only affected bone. But we did find out that no, not only bone, it affected the soft tissue as well. So she ended up with, looked like she had been in a prize fight, where she had bulging eyes, and they did orbitotomies, which was where they go in and they do, they take pieces of her eyes and try to see what was causing it, the inflammation and everything. And they couldn't come up with anything except for the fact that it was the multiple myeloma. And so she ended up, like I said, passing away with, it had metastasized. Here's a picture of her eyes. I don't know if you can see them.
Yeah.
And it had gotten to the point where her left eye was completely closed, and she had started losing vision in her right eye. It's hard to talk about it because of the unknown, but I was by my mom's side through all of this. And as a caregiver, to see a parent or anyone suffer and go through this, it's very hard. It's hard for the person that's doing it, and it's hard for the patient themselves. My mom never complained. She didn't complain. She didn't. Only thing my mom would say was she needed just pray for her. This was her journey, and she had to be on it. And so, like I told her, Mom, I'm on your journey with you. And I told her I would be there to hold her hand from beginning to end. And I was. When she took her last breath, I was there with her. And as Father Vitalis can tell you, she was a strong woman of faith. If someone comes to you and they say that they have this disease, there's a lot. I would love to be a part of the organization to make aware of everything that you would have to go through. So that's my mom's story.
Thank you for sharing, Ms. Williams. Your story
Thank you.
is
Thank you.
had moved my heart. I mean, I'm sorry.
That's okay.
I take lead of talk. I don't know if I'm allowed to. I
Oh
apologize.
no, hey, no, it's a community thing. We share the mic here.
Yeah. Thank you. I wish that she had been here to be able to share her story herself, because, like I said, she could tell you better than I could about the journey that she was on. And like I said, unfortunately, she came to the end of her journey on September 11th of this year. And it was the hardest thing to, I knew she was in pain. And they even, all the way up to her final day, they asked her to take medicine, and she did not want to take it. But she did eventually, only because I insisted, because you couldn't even lay your finger or touch her because she was in so much pain. So that's why I'm here, just to kind of share what I had to go through to help her. And she lived, when she was first diagnosed, they said 5 years was the max, but Mom lived 9 years and 4 months. Thank you.
Well, we appreciate you. Appreciate your story. It's always wonderful when you're able to, take care of them until they pass. We was blessed to take care of my mother. She died over my sister's house. So to me, that was the greatest blessing to have her, to take care of her as she took care of us. And so you will be blessed tenfold, without a doubt. Isn't that right, Pastor?
You're right.
Thank you.
Good. Without a doubt. See, hey, you can't beat those numbers, baby. You can't beat those numbers.
Thank you.
So I don't know. I don't know if we lost Judith or not.
We didn't lose her. She is taking care of some stuff, and she will be back in a minute. While waiting for her to come back, thank you so much, Rhonda, for sharing your story.
Thank you.
It's not easy. When I started working with Judith, I had her on one of my podcasts. She shared her story as well, and I was there. She was very emotional sharing that story. She shed tears, so it's not easy. I really commend you, Rhonda, on doing this, and we appreciate you.
Thank you.
I guess
It's hard. I was holding back. The tears are here, but I'm trying not to show them.
Oh, no, that's okay. I'll be crying all the time. Ask Martine. I'll be crying right up here. They call me the crying DJ sometimes.
That's right, the kind, DJ. Thank you, Miss Rhonda, for sharing that wonderful story. I wish I'd have known your mom. And I'm glad you said you wish she could be here to share her journey,
Mhm.
because this is my first time. When I met Judy and she came on the show, 95.7 The Boss Morning Show, and explained what it was. I had never heard of it before. So I'm glad that we
Mhm.
have this fundraiser. It's an awareness um, for the community that has never heard of multiple myeloma.
Mhm.
There's something, if it's rare in the Black community, we definitely need to know about it, because there are people suffering from it, and we need to have medical professionals that know how to treat it, and we need to know. We need to have the community be aware of it so that they can recognize some of the symptoms, that they know that they need to go ahead and be seen. If they're experiencing some of the symptoms, um, too many times we put pain off because we think it's something else, or we think it's probably not serious.
Mhm.
But as a Black community, um, we need to be more vigilant about being aware of our body. Our body tells us what's going on. If we listen to our body, and I'm not sure if we have a medical professional on the Zoom call here, but our body tells us when something is going wrong. We just need to know how to listen and take the right steps to go get seen. Even if you think is minute, still get it checked out, um, because you never know what it might be. And so, and this is for any illness, but I'm just, thankful to Judy for, stepping up and sharing her experience. She didn't have to do it, you know, and Rhonda didn't have to share her testimony of her mom's journey with the disease. But because you guys are, giving spirits and you're sharing your testimonies, you're blessing the community, because there's probably others, I'm sure, that
Mhm.
may be dealing with this in the United States or far, anywhere. So thank you for sharing, both of you sharing your stories of your parents. Um,
Thank you.
and if maybe you'll encourage the next person that has experienced it, or maybe they're actually the one that has the disease and they're going through, and they may want to talk from a real life perspective. They're living the journey, and just sharing what those ailments really feel like. Like Rhonda said, her mom can tell the story better because she was living it. So, but thank you so much for bringing awareness to the forefront, for our community, and hopefully we all can go back and kind of help share these journeys, and just share the awareness about multiple myeloma.
Without a doubt. Miss Williams, um, you look beautiful like me. You look beautiful like me. Um, it's
Thank you.
I'm trying to figure out who's more beautiful, me or you. I think you got me. I think you got me. I think you got me. Uh, and
Thank you.
no, we appreciate your testimony. God said we are destroyed because of lack of knowledge. I'm glad you provided us with some knowledge so we can save a few more souls out there, as a pastor would say. So we appreciate you. We are juggling this agenda. You know how we do it. We know how we do it over here. But I want to make that's the right timing. Miss Wade, you came in at the right time. I know you was quiet for some reason. You were staring at me real too hard. Ready to get you, but no, well, we appreciate you. For those that are caregivers. Oh man, um, pastor, I don't. Sometimes I ask God, I said, God, man, I mean, our people have gone through a lot, and then why do we have to go through so much more
Mhm.
in their death? And so, um, I just want everybody to stay strong. I mean, one day we will be caregivers like myself, as well as Miss Williams, as well as many of you on this call. So we got Judith back, and so Judith, we heard testimony from Miss Williams. In your absence, you had people crying and testifying and all that stuff. And so, no, she gave a beautiful testimony of her journey. And to me, success is having the ability to speak from your experiences. So we appreciate it 100%. And so I do want to get the floor back to Judith. Are you ready to get some more information on the background of this ailment, disease?
Yeah, yes. My apologies for that. I have some technical challenges, so that's why I was off for a while. Okay, so Deborah is going to assist me here. Okay. So a little bit history about the foundation. And this is Calistus Multiple Myeloma Foundation. Okay, next slide. Okay, so you have heard, you all have heard this is Miss Williams' testimony about caring for her mom that had multiple myeloma, and also if you want to help in any way, make sure you reach out to your community and anyone that you think that might have it but don't know. We have to encourage our community. I know this might sound cliche, but our men, especially African Americans, we have to make it a need to see our physicians. It's better to catch all this on time than wait till the last minute. So I won't go in details of what multiple myeloma is. We have an oncologist coming in at 5 p.m. She's going to talk more about what multiple myeloma is. Okay, so the care that we do, this is in Nigeria. My brother, he went to the hospital in Nigeria to visit some patients that had multiple myeloma. So some of them need our help. They need resources like medication, treatment, and all that. And knowing in Africa, we don't have the equipment for to be able to diagnose it on time. And even if they found out that you have multiple myeloma, the medication is very expensive. So the foundation, this is the reason that we are here to help our community. They'll go to the hospital and pay them a visit to know what they need. Okay, so this is a surviving rate that we have in the population. So out of about 100 people, 46.6% survive from the multiple myeloma. Like I said, since I'm not an oncologist, the oncologist will have a better insight of the survival rates and then the people that die from the multiple myeloma. Okay. This is a shot when my dad was admitted at the ICU unit. That's my son. He is supposed to join me. He just came back from school. So, so that's my son. Just to show how important it is for family to be involved in within themselves and also the community. Not just family, but if you have your neighbor and your friend that are going through difficult times, reaching out to them goes a long way, because you never know, they might not have anybody in the community to be able to do that for them. So reaching out to family members and the community to help in time of their needs says a lot about the community you have. So, and when it comes to the sick at the hospital, if we have any of our patients or people that we work with that are admitted at the hospital, we reach out to the chaplains or the pastors. Like in Roman Catholics, we always Father Vitalis is going to be a better person to talk more about it. So they go to the hospitals to anoint the sick. So it's more of a detoxin your soul. So the priest anoints the sick, so that way the Lord can welcome them into his kingdom. And I know during that time, the person might be very sick. You can't be able to talk or verbalize anything that you want, but getting that last blessing, even though some of them that get the last blessing might not pass away within the days or weeks, but getting that blessing gives you a peace of mind. So this is another picture of when my dad, that was the last blessing before he passed away. So we also work with local home health to care for our patients when they're admitted at the hospital, help them with their activity of daily living, like their groomings, because usually when you're sick, you can't be able to do anything. So helping them out, making sure that they are moisturized, and taking care of their hygiene is very important as well. So that way it will give them, it will make them comfortable. Because I know if you wake up in the morning, if you don't brush your teeth, you know how icky that feels. So giving them a good hygiene helps to prevent bacteria and dryness. Okay, so we are big with community involvement. Although with the Code V, we weren't able to do something outside to invite people, because we have a lot of plan for this year on the event we are going to do. But we weren't able to do that due to the situation we are in, the pandemic that we're in. So we are involved in our community. We reach out to families to see what they need. So that way we can come in and see what we can do for them. Okay. We are also there to console the family member that their loved one passed away. So we are also there for them to console them. So we always ask for prayers, the support in any way. So if there is any way that you can reach out, the community will always appreciate that. So we also attend, although we didn't do that for Miss Williams, when the mom passed away, we haven't been able to go in person to be face to face to meet her with the Code V, with everything going on. We wanted to make sure that it's safe for her and also for us, so that way we'll find a time to visit her. So we make it an honor to pay respect to our deceased ones. So this is the man that the foundation is dedicated to. That's Sir Obodugo, Calistus Obodugo. So it's in his honor that I opened the foundation. Okay. So that's all I have, just to give you a little bit background of the foundation. If anyone have question, you know how to get in touch with me. We also have our monthly and quarterly meeting within the board members to bring up an initiative on how to help the community and help our loved ones. And also we are planning on the people back home in Africa. We are trying to reach out to our family in Africa as well, so we can let this disease be known to them and to find out on time, so it won't be too late for treatment. Thank you.
Thank you. Well, you know, our awareness is always, well, you know, God said best, we destroy because of lack of knowledge. We're never able to bring knowledge to the table. So just less destruction, and we can save more of our neighbors. So we appreciate you and your effort, taking a pain and creating a rainbow out of it, per se, out of the legacy of your father. And so obviously he's a hero. My mom and dad were my heroes, without a doubt. And so no, we'll appreciate you. Were we going to continue to we're going to tour the website also? Did you want to continue to tour the website also?
See, we can continue to the website until Dr. Hurston joins us. She's supposed to join us.
About 4 minutes.
Yes.
So, well, were there any other questions? We do have a door prize. We do have a door prize.
Yes, you can use the opportunity now to name the door prize.
I don't have the door prize. Somebody got the door prize, but I got a question. Question. Whoever can answer the question first.
Attention passengers.
Hold on a second.
Do not leave baggage unattended.
Not the airport guy. Not the airport guy. I know. See the airport guy trying to get in on us. See, I told you I got the whole airport. The whole airport. So the first question, I'm gonna make it a hard question. This is a real hard question, y'all. Number one, who founded Calistus Multiple Myeloma Foundation? Who founded it? Who's the founder?
Judith.
Okay. All right. See, the pastor. You quit, pastor.
It's Judith.
Okay. All right. Okay. Judy, you did a good job in your presentation. Everybody knows that you created it. I'm gonna see if they really listen though. The second question, we got another door prize. I don't know what the door prize is, but just imagine what it is. It could be a car, or it could be 5 pounds of chitlins. I don't know. What year was the foundation founded? What year was this foundation founded? Can someone tell me the year? Were you guys listening? Oh, it's kind of quiet. Who we got over there? LaWanda, you kind of sounding.
Yes, LaWanda. 20.
You can type it in the.
Type it. Okay, well, LaWanda. Okay, let me see what you got, LaWanda. You gonna type it in there? Let me see. Because your vocals are.
Type it in the chat.
Yeah, type it in the chat, Miss.
The
LaWanda.
audio's not coming through well.
Yeah, and then and who's the brother with the tie on? Was it Tory? The brother with the glasses and the black and gray tie. Is that Tory?
Oh, Drizza? Drizza Tory?
He ain't saying that. He's real quiet, man. Come on, man. Take it up to a brother. Talk to me now.
As always.
I mean, you the only one got the smooth tie on. I don't see nobody else with smooth tie.
Because I was presenting today too. That's the reason.
Well, I appreciate you, everybody. And like I said, we got our guest coming on in about 1 more minute. The doctor will be coming in at 411.
He's here.
She's here?
Mm-hmm.
Where's the doctor at?
In.
Okay, all right. Well, thank you,
King,
doctor.
we got a response for your question, LaWanda.
LaWanda didn't answer it?
She answered 2012.
2012, is that right?
Is that correct, Judy?
No,
what year was the foundation founded? 2012, is that correct?
No.
2020.
2020, 2020.
We're doing our launch right now.
So 2020 is the correct date.
Yes, because my dad passed away 2016, so it was after he passed away.
Okay. Great. Well, we'll come back with some door prizes. We actually have our special guest on the air, Dr. Sarah Holstein.
Holstein, correct.
Holstein, okay. She works at UNMC. I like the background. You're looking real sharp in the red.
Thank you.
We appreciate you coming out and taking time and giving us some knowledge. So, doctor, you have the floor.
Okay, great. I wonder whether somebody can give me the ability to share my slides, share my screen.
Go ahead, you can do it.
You should see a green button at the bottom of your screen that says share screen.
Okay, give me a second here. Oops. Okay, can everybody see?
Yep.
Yes.
Okay, perfect. So I was asked just to give kind of a brief overview of myeloma, but first I'll just tell you a little bit about myself. So I'm originally from Iowa, where I did all of my training, and I've been a myeloma physician now for more than 10 years, first on faculty at the University of Iowa, and then I moved to Buffalo, New York, where I was on faculty at the Roswell Park Cancer Institute. And then I moved here to Omaha a little over 4 years ago. So I started, I think, September 1st, 2016, serving as the leader of the myeloma team here at UNMC. So my clinical practice is completely devoted to the treatment of myeloma and related plasma cell disorders. And then in addition, I also have a laboratory which is devoted to trying to come up with new drugs for the treatment of myeloma. So I'm always very excited to talk about myeloma because it's a disease that I'm very passionate about in terms of trying to improve outcomes for the patients who suffer from it. So that's me. And I just wanted to provide kind of a little overview of what myeloma is, and feel free to stop me and ask questions. But I was told I had about 20 minutes and I probably have about 15 minutes worth of slides here. So first, just what is multiple myeloma? And sometimes one of the things that's confusing to patients is that I will use the term myeloma or multiple myeloma interchangeably, and really they mean the same thing. But I often tell my patients it's just easier to keep saying myeloma as opposed to saying multiple all the time. But ultimately, this is a cancer involving cells that live in the bone marrow. And the bone marrow is the spongy liquid tissue found in the center of our bones. And that's where all of our blood cells get made. And one of the types of cells that live in the bone marrow is called a plasma cell. It's a type of white blood cell. And it's very important for our immune system because these are the cells that make our antibodies, which help us fight infection. So as you know, these days in the news from COVID, mounting an antibody response to the virus is incredibly important, just as it is with any other infection. And these antibodies, which are proteins, are made by these plasma cells. And as we'll discuss, for most patients, we don't understand why, but when these plasma cells become cancerous, we then call this disease myeloma or multiple myeloma. So myeloma cells are cancerous plasma cells. And in terms of the big picture about what myeloma does to the body, shown in the center are these plasma cells, the malignant plasma cells under the microscope. And by definition, since these myeloma cells are at heart plasma cells, they still make antibodies or protein, but these antibodies are not helpful. They're not being made because of a particular infection or a vaccine. They're just being made because it was whatever protein the original cell was programmed to make. And so these cells make excess antibody, or what we call M protein or monoclonal protein, and we can use that to track the status of the disease. But this protein or these antibodies that these cancerous cells make also contribute to the morbidity of the disease, particularly with respect to hurting the kidneys. So it's fairly common for patients being diagnosed with myeloma to have evidence of kidney disease. And what I often tell my patients is that they can think of it as these very high levels of protein can clog the kidneys and hurt them. Another thing that is very common with myeloma that leads to a lot of morbidity is the development of myeloma bone disease. And so what I'm showing here is a very extreme example. This is an X-ray, and you can see a fracture as well as large holes in the bones. And so the myeloma cells, which live in the bone marrow, interact with the normal bone cells and kind of make them go crazy and start chewing up more bone than they should. And that leads to these holes, which can be very painful. And of course, if fractures occur, that can be very painful as well. And sometimes that's the way that myeloma presents itself, is that somebody fractures a bone kind of out of the blue, not because they had an injury, but because the bone has been weakened so much from the myeloma. And then the other nasty things that myeloma does includes causing anemia, so low red blood cells. And you can think of this as being a consequence of the bone marrow being filled with the bad cells, and so no longer being able to make enough good cells like the red blood cells. because these cancerous cells are part of the immune system and because they are no longer making proper antibodies, this means that people become immune suppressed. And therefore, one of the most common causes of death actually in myeloma is due to infections. So what causes myeloma? The bottom line is, despite all the technical advances we've made over the years, we still really don't know. It looks like a very small percentage of patients might have a genetic predisposition, but at this point, there's not one particular gene or even a panel of genes that we can screen to try to figure out whether or not somebody's at risk for developing myeloma. There's been a lot of studies and data looking at exposure to things like radiation or chemicals or herbicides and pesticides, and potentially all of these factors might increase somebody's risk, but is unlikely to be the one thing that leads to somebody developing myeloma. Perhaps the one exception to this would be Agent Orange exposure during Vietnam. There's some data that obesity may increase the risk, but certainly there are many more obese people in this country and in this world than there are that develop myeloma. So that's not the answer either. But unlike many other cancers where there is a clear association with tobacco or alcohol use, we really haven't found that with this particular cancer. So how does myeloma present? How do you know if you have myeloma? Many patients have no symptoms at all at diagnosis. So sometimes it's just that they have some routine blood work ordered, perhaps by their primary care provider, just looking at basic labs like their blood counts or kidney function, and are incidentally found to have anemia or have abnormal kidney function, or sometimes the only subtle finding can be too much protein in the blood. And any of these abnormalities might then lead the doctor either to do more tests themselves or to order or to refer the patient to somebody like myself to work them up for the possibility of myeloma. For patients who do have symptoms and signs, there's not one specific symptom or sign that leads somebody to say, aha, you have myeloma. Bone pain certainly can be a common symptom, but also recall, particularly in the older patient population, that people can have a sore back for a lot of reasons, and having bone pain or having back pain, for example, is not a sure sign of myeloma. As I mentioned, unexpected fractures certainly raise the possibility of having myeloma. Frequent infections, particularly frequent pneumonias, would raise the question of whether or not somebody's immune system is not acting properly. Fatigue is a really non-specific symptom and sign. I think all of us these days during the stress of the pandemic and everything that's going on are more tired than normal, and we might be completely healthy or we might have something more serious going on. As I mentioned, unexplained kidney damage is certainly can be a sign of myeloma. And then in a small percentage of patients, unexplained weight loss can be a sign that something's going on. But again, that's not specific to myeloma. So it really takes somebody really thinking about the possibility of myeloma to come up with the diagnosis. So who gets myeloma? Well, for the most part, it's a disease of the older patient population. So the most common age at diagnosis is in the late 60s, and the most common age at death is in the mid 70s. It's a pretty rare cancer. It represents only less than 2% of all new cancer cases. Looking at how many cases will be diagnosed in 2020, it was estimated that only about 32,000 will be diagnosed. Again, when we put this in comparison to more common cancers like lung cancer or breast cancer, it's really a drop in the bucket. But obviously for each individual person who gets diagnosed with myeloma, this is a really serious diagnosis. I looked at the data for Nebraska, and it was estimated that in 2020, 180 new cases would be diagnosed. And then when we look at the number of deaths each year in the US, it was estimated for this calendar year that there would be nearly 13,000 individuals dying, and in Nebraska, 80 patients dying. Just a little bit more information about who gets myeloma. It's extremely rare for somebody less than the age of 39 to be diagnosed with myeloma. I've had a handful of patients over the years who've been between the ages of 30 and 39, but really it's pretty much unheard of for anybody who's a child, certainly to get myeloma, or who's in their 20s to get myeloma. But as you can see here from this graph, as you start getting into patients who are older than 40, you do start to see an increase. But really, once you get into this pink bar here, that's patients who are 65 and above. And then if you look at patients 75 above, that's where the highest rate is. So there's something about the aging body that predisposes people to getting myeloma. What about men versus women? Well, interestingly enough, men have a higher risk of getting myeloma, and we don't really understand this. It doesn't appear to be a hormonally influenced disease, but clearly there still is a sex difference here. So looking at rates per 100,000 in terms of new diagnoses, you can see that there's nearly a doubling of risk for men versus women. The other thing that has been quite clear in this country is that there's a difference between risk based on what the race and ethnicity is of the person. And so I've just included some of the data here from the US SEER population data. But in general, and again, for reasons we don't understand, people of Asian descent appear to have slightly lower risk than people who are considered white or Hispanic. And what has been clear for decades now are that Black individuals have approximately double the risk that white individuals do of getting myeloma. And so if you look at both age and race together, Black men have the overall highest risk of myeloma and white women have the overall lowest risk. There's a lot of studies being done to really try to understand what the differences are. And there are some data showing that some of the changes that happen inside the myeloma cell, some of the pathways that the cell goes through when it churns from being a normal cell to an abnormal cell are different in myeloma cells from Black individuals compared to white individuals. But to be honest, we still really don't understand that, but there certainly are a number of groups in this country and really worldwide trying to understand this. One of the things that can sometimes be confusing to patients about myeloma is the staging. So I think many of us are used to thinking about, well, if somebody has a stage 4 disease, for example, that means it's pretty bad, it's spread all over the place, that's really different from a stage 1 disease. That's certainly true for cancers such as lung cancer or breast cancer, prostate cancer, et cetera. But in myeloma, by definition, this is a cancer that's in the bone marrow, so it's already all throughout the body. So we don't think about it based on how many locations it is in the body. Instead, historically, we've developed staging systems that really just look at overall burden of the disease. And the most recent staging system that came out 5 years ago is based on a couple of blood tests and then some of the genetic information that we get from inside the cancer cells when we look at those cells. And so based on that, you can see that in that staging system, patients with stage 1 disease shown in this blue curve have much better survival than those with stage 3 disease. But again, it really doesn't have anything to do with how many places in the body the myeloma is. So unfortunately, what I have to tell all of my patients when I'm counseling them is that right now, even in 2020, myeloma is not considered a curable cancer. We've made remarkable advances, and I'm going to go into detail in just a little bit about these advances and for treatment, and those advances have led to this becoming a disease that in many patients can be considered much more of a chronic disease. But still, at the end of the day, nothing that I can do and none of the therapies that we have available can make the myeloma go away forever. So in that context, when we're talking about what the goals of treatment are, we're really focused on a couple of things. One, of course, is to prolong life as much as possible. But the other is to improve the quality of life and maintain that quality of life for as long as possible. And then to kind of hand in hand with that is to prevent complications that are caused by the myeloma. So if we can prevent the kidney failure, if we can prevent fractures and bone pain, then not only will we make patients live longer, but we will also make sure that they have a better quality of life. So this, I think, is I think history is always really interesting, and in specific, myeloma history is really interesting. So this is a condensed timeline dating back to the 1800s when the first couple of cases of myeloma were described. And at that time, there were really no treatments available, but you can find a couple of what we would consider case reports these days of remedies such as rhubarb and orange peel or steel and quinine. And needless to say, these weren't effective therapies, and patients generally died almost immediately after diagnosis. And in many cases, the diagnosis wasn't made until after patients were deceased. It really wasn't until the 1950s that the first real treatment for myeloma was developed, and that's a drug called melphalan, which is a drug we still use today, mostly in context of transplant. But melphalan is a derivative of a nitrogen mustard agent. Those were agents that were first developed during the First World War as chemical warfare agents, but subsequently were noted to have activity against some cancers. And then in the 1960s, it was discovered that steroids like prednisone or dexamethasone have activity. And so even today in 2020, nearly all of our myeloma regimens will include some sort of steroid such as dexamethasone because they tend to make all the other drugs work better. When I first started learning about this disease in the 1990s, we really only had one chemotherapy regimen outside of transplant. But very quickly thereafter, and it's in part why I chose to go into this field, there suddenly became enormous advances with new classes of drugs, which have really revolutionized the care of myeloma. And so if we look at the 1980s and 1990s, patients were in general only living 2 to 3 years. Once some of these new drugs came out in the early 2000s to mid 2000s, suddenly we were seeing survivals improve to 5 years, so essentially doubling. And then you can see listed under 2010 that decade, there was a whole flurry of new drugs that have come out. And even just this year alone in 2020, we've already had 2 new drug approvals. So these days when I counsel patients who are newly diagnosed, I say that I think that many patients are surviving more than 10 years, but it's really hard to estimate because in the next couple of years, we expect many more treatments. And with each new treatment, they tend to add months, if not years of life. So how I might treat somebody right now with newly diagnosed myeloma is going to be very different, I think, in 5 years. And the options for when they relapse are going to be very different in 5 years compared to what we have now. The ultimate question, of course, is whether all these new advances, some of which are listed here and some of which still haven't even been discovered, whether that will ultimately lead to cure. I'm hopeful that in my lifetime it will, but at the very least, if we can at least truly cause this to be a chronic disease, somewhat like heart disease or diabetes, where the disease can be controlled and patients can live a somewhat normal life and have a normal lifespan, that would also be considered a win. So this is just some data showing that we're doing better as we get kind of by decade in terms of how long patients are living. The red curve represents patients diagnosed in the 1990s. And as you move up through those colors and get to the purple curve, that's between 2008 and 2012. Presumably, if we have data from the last 5 years, that curve would be even higher, indicating that patients are living longer. The other thing to note about myeloma is that we have really good initial treatments and we have good subsequent treatments. But what happens with each subsequent line of therapy is that the duration of response decreases. And that's what this graph is showing. The black line on top represents survival from start of the first therapy that patients get. So that's the longest survival. And then as you go down from red to green to blue to purple, that represents subsequent lines of therapy. So once the disease has started to figure out how to outsmart drug A, B, and C, and then drug D and E, and then drug F, and then drug G, the likelihood that subsequent drugs after that work becomes less. And unfortunately, the response time becomes less and less. So that's still a major challenge in the field, is to figure out new ways to combat the disease and outsmart the disease after it's become refractory or resistant to all of our current therapies. So to sum things up, what are the challenges facing patients with myeloma these days? As I said, what we tend to do is to go from one treatment to the next. And in particular, what we currently do is to have patients stay on a treatment for as long as it keeps working. But what that really means is that patients are not getting breaks from chemotherapy. So they might be on their initial treatment for a couple of years, and then when that stops working, get put on something else, which might work for a year or so, and then switch to something else, et cetera, et cetera. And not having breaks from chemotherapy can, of course, cause a lot of problems to the patients. And there can be cumulative toxicities that occur from chemotherapy. That can be the development of neuropathy, which is nerve damage, development of low blood counts, increased risk of infections. Some of the treatments that we give can have effects on other organs, such as the heart or lungs. And so it's not an easy thing for patients to stay on chemotherapy long term. There's also complications from the cancer itself, especially when the myeloma is not well controlled. It can cause fatigue, as we talked about, it can cause bone pain, and infections remain a serious problem throughout the course of somebody's disease. And there's a huge financial toxicity of the treatments and the disease itself. So many of these new therapies are just outrageously expensive. And yes, many times insurance covers them, but sometimes copays, even if it's a relatively small percent, might still be more than patients can easily manage. There's lots of data in the myeloma literature talking about the financial toxicity. And you also have to recognize that sometimes this disease can turn somebody from being fully employed and fully functional to somebody who might have to go to part-time or even retire early and try to go on disability because of the complications from the disease and also because of complications from the treatments. And as I mentioned, eventually the cancer becomes resistant to all available therapies. And for the vast majority of patients with myeloma, the cause of death will be the myeloma itself. And then because this is a disease primarily affecting older individuals, they may very well have other health problems. So that might be other cancers or history of other cancers. It might be diabetes, heart disease, lung disease, et cetera. And any of those other conditions may limit our ability to give the myeloma therapy that we think is optimal because of side effects or other issues. And so it's not just the myeloma that a patient faces, it's all of their other health conditions. And so I think that was my last slide. So I'm happy to stop screen sharing. I can get back into Zoom, or if you can stop screen sharing for me, that'd be great. And I'm happy to take any questions.
All right, doctor, we appreciate you. Is there any questions for the doctor? Great presentation.
Yes, thank you so much, doctor. So I have a question. You mentioned, well, I think it may have been in Judy's presentation. She mentioned the survival length of time after one is diagnosed with the disease was 5 years. Is that average for, or it just depends on the person?
Yeah.
The average length after they've been diagnosed, they tend to be able to live at least 5 more years after being diagnosed. Is that?
I would say these days the minimum is 5 years, but for many patients, especially patients with what we call standard risk disease, which kind of gets into subtleties in the cancer cells themselves, but that for those patients, we think their survival is well beyond 10 years, many patients 15 years. It's hard though to give those numbers again, because if you're an 80-year-old getting diagnosed with myeloma, your average survival anyways is unlikely to be 15 years. Most people don't live to the age of 95, versus if you're 45 years old being diagnosed with myeloma, normally you would be expected to live another 40 years. And so those factors are in play. But also, again, all the survival data that we have is historic in nature. So it's based on people who were diagnosed 10 years ago who didn't have any of the treatment options that we have available today. So when I'm faced with a newly diagnosed patient today, I tell them for the most part, I think it's 10 years or more, but again, that I might be underestimating things because of all the new advances that are still coming down the road.
Okay, great. Is there I'm sure there's probably continued research and development as far as treatments.
Leave baggage unattended.
Is that available to anyone? Are you treating patients from overseas and other countries? Are the advances more prevalent here in the United States? And would there be opportunity for people that don't live here to come and get treated?
It's an excellent question. So clinical trials for new agents occur all over the world, although many times it's more in the developed countries. So many of the studies that lead to FDA approval are either done in this country or in European countries, and then less commonly in the Asian countries. There tends to be a delay in getting access to new drugs in countries outside of the US. So in general, the US tends to be the country that gets access to all the new drugs or gets approval first. In part just because of regulatory issues. In Europe, they're much more strict about needing to prove cost-benefit ratios, and that so far hasn't been so much the issue in this country. Certainly there have been patients from all over the world who have come to the United States to get access to clinical trials. If it's not on a clinical trial, then it becomes tricky sometimes because if they're not in this country, they might not have insurance. But I do know that some centers more frequently than not will accept patients who can kind of self-pay. So if they're very wealthy patients from the Middle East, for example, or for Africa, who can come and pay for a treatment, they can come in and receive the treatment. For the most part, at our center here in Omaha, we tend to care for patients in Nebraska and surrounding areas. I personally have not been involved with too many patients from outside of the US who have come specifically to this center for treatment.
Okay, thank you.
Thank you, doctor. I have a question. Since this disease is almost incurable, what use is the chemotherapy then?
So if you don't get treatment, then you're likely to die within about 6 months. And in the meantime, you will likely go into kidney failure and break bones. So with treatment, we can prevent the kidney failure, we can prevent the broken bones, and we can make people functional and live for 10, 15 years longer.
Wow.
Hi, Doctor. This is Lawanda Stickwell. Can you hear me okay?
Yes.
Okay, because I have a new computer and I think I worked it out well.
Okay.
The question I have for you is, you said there is a high minority rate of African Americans that this disease attacks. And I wanted to know, what is your clinic doing to help those that are unable to afford such a high price treatment?
Yeah, so it's an excellent question. Here at Nebraska Medicine, we have a very large team of financial counselors, and it's really, I can thankfully say that I've never had to alter what I think is the best treatment option for a patient based on their ability to pay. Many of the drug companies have patient assistance programs, and we have personnel at our center who will help the patient apply for those. So I never have to not give a drug because of somebody not being able to afford it. We always have workarounds to make sure that patients, no matter what their financial or ethnic background is, can get access to the best quality treatment.
Thank you so very much, and thank you for your service.
Thank you. I will say though, one of the things that I started doing in Buffalo, but haven't had the opportunity to do here, was really just try to serve as a teacher to the Black community in terms of knowledge about myeloma. There, at the time when I was in Buffalo, there was the Leukemia Lymphoma Society was starting a series where they would go into the community and talk to health leaders and health ministers and just try to educate people about myeloma. It's not a cancer that most people are aware of because it is a rare cancer, but in particular, since it does affect more Blacks than whites, it's really important that everybody know about it so that it's at least kind of in the back of their minds to talk about with their doctors. And so I think trying to spread the word that this disease does exist is important.
Is there a lifestyle that is known to help mitigate the risk of being infected with myeloma?
That's a great question. The short answer is not really. To the extent that maybe obesity plays a role, you could argue that trying to be as fit as possible might help a little bit. But the bottom line is I see people diagnosed with myeloma who are all shapes and sizes, have had all sorts of diets throughout their life. And there really doesn't seem to be an answer for how to prevent this from happening.
Thank you.
Are there any other questions for Dr. Holstein? Anyone?
Well, thank you for having me, and thank you for everything you're doing here with this foundation. I'm looking forward to being able to work with you in the future.
Thank you.
Thank you,
I also,
Thank
want
you
to
for your
say
time,
thank
Doctor.
you so much. Thank
Bye-bye.
you for coming. Thank you.
That was great information. Thank you so much.
Thank you very much. God bless you.
God bless you.
All right. Appreciate. When you want knowledge, you got to go get it. God said, you seek, you shall find, without a doubt. So that was a great addition to the on the background. So we can have some knowledge on as we mature. Because I'm 55. I don't know how old the pastor is, and being Black males.
I hear you.
And recognizing that that we are in that category, and so just having some foresight, having some knowledge is a good thing. So we appreciate this for sure.
It's very good.
So we already got our testimony from. So we got our testimony from Ms. Williams.
Mr. William, I forgot to share that my mom had also had the transplant that they did. And she did really well with that. She stayed over at the Lead Center. She had to be there for at least 2 weeks and before she could come home. So she had even been through the transplant as well.
But she had a bone marrow transplant?
Yes. And she had to, they harvested 12 vials or 12, whatever they call them, units of plasma, and they eradicated it. And she, as a matter of fact, still has 11, either 11 or 10 units still over at the Med Center and frozen. Because after she had they went ahead and gave her the transplant, and she did very well with that. They froze her, the other units, just in case she would have to use it again. But then the proteins took over so much till they couldn't use it because she could not they couldn't build her own plasma.
Okay. Well, cool. Well, we appreciate you, without a doubt. Judith, is there anything that we still need to cover?
Deborah,
some questions.
Oh yeah, I
more questions. You got the questions?
I know we got some door prizes. Do
Oh, yes, we can, Deborah and Katie can give us some information, and then we'll finish the door prize question.
Okay.
All right. So thank you guys for joining and staying till now. We really appreciate it. So we just wanted to share some information on some of the services that we provide. And Judy, during her PowerPoint presentation, she kind of mentioned most of them. So I'm just going to remind everyone that we do provide transportation to the patient when it comes to non-emergency medical transportation for them to, go to the pharmacy to get the prescriptions, or if they have errands, they need to go to the store, or anything really that they want to do. And when they notify us ahead of time, we can schedule to pick them up to ease the transportation concerns. And that's one of the reasons why we need support. We need to continue fundraising, because most of these patients, they probably have Medicaid, but when it comes to those errands, like go to the store or go to, I don't know, go to visit a family member or something that is not like going to the pharmacy to pick up the prescription, then Medicaid doesn't cover it. They have to pay out of their pocket, and your donations are really helpful when it comes to that, so that we can continue providing this type of services to the patient. We do also coat drive during winter, and if you know anyone, or if you have organizations that are able to donate coat to this foundation so that we can help patient and their family, we will really appreciate it. We also help with activities of daily living, meaning like Judy was providing oral care for her dad. We also help with that. We do cleaning. We clean the apartment, and we partner with local company. It might be cleaning companies or any other company, individuals, or companionship to help to provide these services to the patient as well. We do a lot of outreach to the family members to kind of see what they need, what's going on, how are they coping, and if there is anything else that we can help them with, we do that a lot. And we consult families when it comes to that moment when we know there is nothing really that can be done. And we do attend funerals when it's safe for everyone. Due to COVID-19, it's kind of different right now, but that's something that we intend to resume when the circumstances allow us to do it. So in a nutshell, that's what we do. And like I said, your donations are very needed and appreciated. Continue to spread the word, and we can, doing so, we can help many more families.
Okay. Thank you, Deborah, for sharing that. I appreciate it. I have Katie. She is going to talk more about the services we offer.
I'm going to go into ways to give, to follow up on what Deborah just said. And I don't think I have to convince people on why giving is important. I think everyone here has heard a testimony and heard from the doctor on how this disease impacts people. I'm going to talk about some alternates to a cash donation that we have set up as a foundation. And the first one is Amazon Smile. I'm sure many of you are Amazon shoppers, And for anyone that already has an Amazon account, you can go to smile.amazon.com and purchase the stuff that you would normally purchase through amazon.com, but a percentage of your purchase goes back to the foundation. And again, that's smile.amazon.com. And I have price checked it from something that you could go to Amazon and buy versus smile.amazon.com, and they are the same price and the same items. It's an easy way to give back items that you were going to purchase already. Another way to give is through TAG. So for those of you who are local in Omaha, there's a company that helps nonprofits called TAG. It's Together a Greater Good, and it's an app that you can download. They partner with local nonprofits and local stores and restaurants, and a percentage of your purchase goes back to the foundation. I think that you would be surprised in some of the everyday stores that you may shop at, anywhere from Hy-Vee to Dunkin' Donuts to there's some salons on there, beauty shops. There's a lot of different variety of stores on there that you can shop at. You just save your receipt and upload it to the app. So that's Together a Greater Good. Also on Amazon, we have a wish list for the foundation, which is to collect items that patients may need, anything from masks and sanitizer and gloves to adult diapers, nutritional shakes, throat lozenges, all of those things. And we collect those items and then redistribute them to people who are living with the disease. The wish list is the Calistus wish list, and you can go on Amazon and search for the wish list and you will find it there. Any items that you purchase off that wish list will be shipped to us and redistributed for patients. If you have items that are already on there and want to donate, please reach out to someone on the board and we can pick up the items and distribute them. We are also on Share Omaha, and Giving Tuesday is coming up. And so that would be cash donations. You can give on Share Omaha or also on our website directly. Did I miss one, Judy? There's our website takes you to Share Omaha. Yeah.
Yeah. I wanted to see if I can share my screen, or Deborah, if you can do me the honor, you can pull up the website.
Okay, I have it.
I don't want to get frozen again. So that way we can give a little tour to the website. So thank you. So this is the website. If you type Calistus Foundation, I didn't want to put the whole name because it's going to be hard for people to remember. So I just only use the first name, which is my dad's name, Calistus, and then foundation.org. So if you go to the website, we have the header, the home, about, news, donation, event, and get involved, and then contact us. So under the home, if you click the home, you're going to see read about our vision and mission, which is the reason why the foundation is created and how we are going to help our community to bring awareness to the disease. So I know we started small here in Omaha. I know I say small, but we have a mission to expand it all the way to Africa, because like everyone heard, like everyone heard, it is more dominant in African American than the other race. So it is we're going to expand it all the way to Africa to reach out to our people back home as well.
Can you hear me?
The much we can.
I'm in a board meeting.
Okay, and then we'll go on that about. So under about, we have the, let's see, Deborah, can you show the about? There you go. Okay, so under the about, we have the history. You can go there and read about the history of the foundation. And then you can see our board members there as well. And the initiative, which is what we do and how we can help the community. The code drive, transportation, and helping with house cleaning as well. So under the news, you find the real life story. Like I mentioned before, my brother went to hospital in Nigeria to visit some multiple myeloma patients. We have their stories there. We have a man that has 5 kids. He's the breadwinner. So after he got sick, the family has nothing else. So because they all depend on him, so he's admitted at the hospital. He needs money to pay his to get the medication and pay for the hospital stay, so he can go back home to the family. You can also find the interview that I did with Deborah when I started the journey of how I started the foundation. You can also find information on just to read more about multiple myeloma. So under the donation, if you can click there for me. So the donation, we have a secured, this is a secured website. So if you click on the donation, it leads you straight to Share Omaha website, which you can donate any amount that you want. And another thing that is coming up December 1st, they have a Giving Tuesday that is coming up. So it's a day dedicated to all the nonprofits in Nebraska for people to reach out to different nonprofits to donate any amount that you want. So it's either you go to our website to donate, or you can go through Share Omaha. If you type shareomaha.org, once the website comes up, you go to the search button, just type Calistus. When you start typing Calistus, the foundation is going to come out. So the Giving Tuesday is coming up December 1st for the community to donate to all nonprofits in Nebraska. If you do the back button, thank you. And then if you go to get involved, the last weekend, we had a volunteer, we had a health fair that Calistus Foundation was a part of. So we used some of the funds that people donated to us to buy toiletries and some PPE to donate to the community. So the health fair, it was free to the community, although due to the COVID, and that was during the election time, and Huskers were playing football. So we had quite a number of people come out, about 200. So it's a flu shot. We gave everyone that came out that day flu shot, and also gave them a little takeaway, a thermometer, toiletries, and face masks, and gloves. So we partnered with UNMC to provide that to the community. And to also know the event that is coming up, you can also go to our website to sign up for any volunteer opportunities that we might have. For high schools or even for college, this is to encourage people to volunteer. I know some high schools, they need some volunteer hours for any curriculum they're doing in school. This is also a good way, not just for Calistus multiple myeloma, but reach out to, especially through Share Omaha, you can find tons of nonprofits that need volunteer opportunity for anyone that is looking to help the community and get involved. So under contact us, under the email, So the email will show you all the list of the board members. So we have our names there and our email. You can reach out to us to get any information. If you can reach me, we have the emails there, although we still have to add more emails to the board members that just joined us. So reach out to us and we can see how we can help you, your loved ones, or anyone that you told about the Multiple Myeloma Foundation. We'll find a way to help the much we can. So that's our website. All right, that's it from me. All right. Okay. All right. Our co-host, Martine. Okay.
Yes.
Can finish up with us.
All right. Yes. We are back. Okay, so thank you so much. We've had some great presentations within the last hour, and I hope everyone was able to learn more about multiple myeloma and take some notes and be able to kind of share it with other people. We have a couple of more questions. Judy has some more door prizes, so we'll see who gets to win. Let's see, the next question is, what are the ways to get involved? Who can give me one way? Does anyone remember?
To get involved in what?
In the foundation to help.
Amazon, my favorite place.
Yes, my favorite place too. Who was that?
Lawanda Sukwa.
Lawanda. Okay, note that Miss Judy, Lawanda, she gets to win a prize. Yes, you are able to get involved by purchasing on smile.amazon.com. Proceeds will go to the foundation. So definitely those of you that shop on Amazon like I do, I'm an Amazon girl. So I'm always, as a matter of fact, as soon as we're done here, I'm going to check out smile.amazon.com and see how I can help support, because I am a shopper on there. We want to help with this worthy cause to help organizations like Judy support those families that are in need and help those individuals that are suffering with the disease, to help them with their daily living. So those proceeds will go to help in that area. So good job, Lawanda. Okay, we have another question. Is we still have some time, Judy?
Yes,
one more question?
we have 6 minutes, then we can wrap it up. So everyone
Okay,
can
all
have
right.
a chance to win some face masks.
Okay, I think this one for you. I'm going to skip down to this one.
Okay.
Who in this Zoom follows Judy on social media platforms or her foundation, Calistus Multiple Myeloma? Who follows either one of those platforms, social media platforms? And tell us which social media platform you follow on. Anybody?
I follow her everywhere. So
Lawanda, is that you again?
yes, it is. And I'm gonna donate my gifts.
Awesome. Oh, that is so nice. What platforms are you following Judy on, or the organization, the foundation?
Well, the foundation, Facebook, Twitter,
and Instagram.
Instagram. I'm all of them, pretty much. I know my sister very well.
Great.
Thank you.
Wonderful, wonderful. So also, yes, Twitter is another platform that you can find Judy on. And there was someone else that chimed in about the same time Lawanda did. Who else out here follows Judy or the
Johnny has
foundation on
his
social
hand
media?
raised and he put, I think his response in the chat box.
Oh, Johnny,
Oh, yeah.
let's look. I didn't see it. Okay, Johnny. Oh, okay, I see it now. He says, I follow her on all social media platforms. All right, Johnny. Maybe we have two prizes for LaWanda and Johnny for this question, Judy. You think we can do
Yes.
that? Okay, good job, Johnny. You
Take it to
chimed in right
Nigeria.
on time, right like a second after LaWanda. So you both are winners. Both get a prize. We get some face masks. All right, good, good. You guys were listening. Okay, this is a very good question so that we can make sure that we test you guys understanding if you were listening. Who can answer this next question? What is multiple myeloma?
Come on. John, are you saying something?
Multiple
What
myeloma.
is multiple myeloma? Anyone?
Multiple
Go ahead.
myeloma.
Who's speaking?
Rhonda
Please.
Williams.
Miss Rhonda Williams is speaking.
Multiple myeloma is the total proteins that are high in the bone marrow.
What's more diseases?
Yes.
Okay. Is that correct, Judy?
Yes.
Good job, Rhonda. Thank you so much.
Good job.
Thank
you
you.
are a winner. You are a
Thank
winner.
you.
It's important to know what multiple myeloma is so that you can explain it to the next person. So we know it's a bone marrow disease. You don't have to get too technical, but you can kind of let people know how it affects those that are suffering. And I think you'll be good. So good job, Rhonda. And again, Rhonda, thank you so much, Ms. Williams, for your testimony and just kind of sharing your mom's journey. My heart goes out to our caregivers. Watching their loved ones, their parents suffer with the disease. And I'm sure you did everything you could possibly do to keep her comfortable.
Yes. Thank you for inviting me to
Yeah.
share on our journey. It wasn't just hers, it was ours.
That's
So
right.
thank you all. Thank you for creating this foundation to make awareness for everyone that, like I said, it was unknown really. And my mom, it was a nurse and she had not even heard of that disease. So I appreciate everything that you guys are doing. And just keep me prayed up like I will you. Yes. Thank
Absolutely.
you.
Yes. And I want to say, just to say thank you to Miss Williams, Rhonda Williams, for joining. When I met her, I heard a story about her mom. So we shared the same story, caring for our parents that has multiple myeloma. And like she said, most people don't know about the disease. So I can empathize with her where she's coming from. Although I wasn't able to see the mom personal, because everything happened during the COVID. So I didn't get the opportunity to meet the mom in person. But I've heard about the mom's story. I know that it would have been an honor for me to meet her in person. And having you here I'm very grateful for you to join us and to share your story. And thank you so much. We are going to be there. Reach out to us if you need help, if you feel like you want to talk to someone, reach out to us. Don't hesitate. I appreciate your time and
Thank
for
you.
joining us and telling us about your story.
Thank you. I appreciate it.
You're welcome. And you'll keep in touch. We'll make sure that you will remember you in prayers and everyone as
Okay.
well.
Thank
And people
you.
that are suffering for it that don't know what it is.
Right. Thank you so much.
You're welcome. You're welcome. Okay. I think that's all that we have. Do anyone have any question or any comment?
I want to thank all of you for allowing me to learn about this disease that I did not know. And Miss Williams, you're awesome. Thank you.
Thank you.
Sharing. I lost my mom to cancer, but it was ovarian cancer. It really doesn't matter. When you lose a parent, it's personal. But what I do is I share my testimony with others, and it helps lessen the burden on other family members. All we can do is share. So we thank you. And Judith, thank you for sharing your dad. I don't know him, but because you've helped me learn about your foundation, Dad has become a part of me. So together, we all get through this. That's what makes this great. Knowledge coming together and sharing is needed. We have to come together. America has to do better. And if they don't, we will. We will. Thank you. Thank you for having me here. I appreciate you all.
Thank you. I appreciate you joining us as well. Thank you.
That was awesome, Lawanda. Thank you so much.
I want to thank everyone else for your participation, and especially for those who put this together. Great job. Martin Puerte, kudos for the hosting. I know your partner
Thank you
actually
so much.
betrayed you at the last minute, but
He betrayed me, yes. I don't know if you call it betrayal if he warned me, but nonetheless, he's gone.
Yes,
I'll let him know that next time.
That's okay. We have each other's back, so we're all in this together.
Yes.
Great. Yeah,
that's true.
Yeah.
Thank you.
Well, thank you so much, sir. Well, thank you everyone for joining in. We do definitely want to respect your time. It is 6:03 now. So I know we've got an evening ahead of us. You've got things to do. So, but we've had a great last 2 hours, and I've definitely learned more every time I hear about multiple myeloma. I learn more. The testimonies here from Ms. Williams and Judy's, her dad, and the presentation and the pictures of your dad when he was being treated. Also took it to another level. Thank you for putting that PowerPoint together and sharing your photos. Definitely it helps kind of visualize, that process of those individuals being treated and what they go through. Obviously, we won't know the extent of it because they're not with us to tell. Like Rhonda said, she wish her mom was here so she could share her journey. No one can tell it better than them, right? But we definitely have gotten more of an awareness, and that was the whole goal of this, was to bring awareness. And I hope that each and every one of you that is on the Zoom, what you've experienced here, and pass it on and share it, or at least talk about the foundation. Tell everyone about the foundation, and support Judy in her mission. It's not easy being a leader of an organization and trying to spark some awareness about what she's doing, what she's passionate about. So let's get behind her. Let's support her. If she's having fundraisers, if she's having events that she's a part of, let's get behind her and let her know that we support her, and we thank her for sharing being the lead and sharing the awareness and bringing that to the community. So thank you all again. I'm going to let Judy have the last words, unless there's someone else that wants to say something before we end tonight's fundraiser event. Okay, if no one else has anything else to say, again, thank you for coming tonight. Judy, we will.
Sammy wants to talk.
Who? Okay, Sammy, you have the floor. Madame Sammy.
Good evening, everyone. Wow. It's been a beautiful evening. I'm actually glad I'm present online to actually learn more about it, because I never heard of the name before until I met Judith and she told me about the foundation and told me what it had went through. And tonight is explosive. Mrs. Williams, I'm super happy that you are able to share your story, just like Judy. Despite the fact that both of you have gone through the same thing, but tonight we see the purpose of why God allowed you both to go through it because He has a higher assignment for you. You can relate with people that are going through it, and you can tell them your journey and how you were able to overcome it. So I doff my hat for both of you. I love you, and I'm here to support you. Thank you so much.
Thank you.
Thank you, Sammy.
Thank you,
Anyone
Sammy.
else?
Thank you.
I see
Johnny?
beautiful faces. Anyone else?
MJ is raising her hand.
Okay.
MJ.
Just saying that. No, I will send you a message, Judy. This was amazing. I was wowed, and it's sad to listen, but also it's great to listen at the same time. This was such a great information. Regardless, we need to learn and we need to teach each other. So I am honored and glad that I was able to join this, and I definitely have learned a lot tonight, and I will share alone the information that I learned, and in any way that I can support, we are here for one another, and I think we share a common goal to help and support each other. So thank you, and this was a great put together event. You all did a great job.
Thank you. Appreciate it. Thanks for joining. Thank you so much.
I believe Johnny has his hand raised.
Okay, Johnny,
Hi everyone.
you have the floor, sir.
Can you hear me?
Yes.
Yes.
So first of all, I want to thank God, and on behalf of the family, the Obodugo family, I want to thank my sister, and I want to thank you all. It's not easy to believe in somebody's vision and believe in somebody's dream, because sometimes people think you're crazy when you have a dream. So I want to thank you all for believing in her dream. I'm really excited to be part of this. I'm really looking forward to doing more, being part of the foundation. And I hope that the energy, the drive, and the conviction we all have to support this foundation, and I hope that God will strengthen us and we'll continue to push this foundation to where it's going to be. So my hope and my dream is that in the next 5 years, this foundation will get to the point that it will be known all over the world. I'm really grateful for this opportunity. And I want to thank you all for supporting my senior sister in her dream. And God bless you all. Thank you.
Thank you, Johnny.
Can we hear your other sister?
If you can, you unmute yourself.
Family affair, so
Maybe she's not available.
Probably she put it on and then.
I'm sorry, I didn't pick up what you said.
If you can, you unmute yourself and say something.
That's okay.
What did you say, Johnny? Okay. She probably put it on and went to do something. All right. Well, I want to say thank you to everyone. Thank you, Martin, for taking up then doing me the honor to be the co-host and now the host. Thank you for your time and for your support. Thank you, Miss William, for sharing your story. And we'll keep in touch and we'll put you in prayers. Thank you, Deborah, for picking up when I have some technical challenges. Thank you, Thank you to my siblings for joining in, and my brother from Nigeria. Thank you to Losar, Sustain. Thank you for accepting to be part of this organization, and I'm praying that together we'll create a bigger foundation and keep it strong for people that will come to us for information and to also help the community. Thank you to my friend and sister, Sami, for joining today. I know you are at work with family and everything that you have going on, but you still made the time to be here. Thank you, everyone. I appreciate it. I don't want to take so much of your time. So if we don't have anything else to say, I will say God bless you all. Thank you. Be safe and have a good night.
You as well. Thank you.
Thank you.
All right. Thank you. Bye.
All right.
Thank you. Bye.
Oh, that's my mom in the background talking.
Hello.
Oh,
everybody's gone. Okay.
Almost
Okay,
gone.
I will, Judith, I'm going
Yes.
to leave.
Okay.
And let you guys. So can I
Okay.
stop the recording so that you guys
Yes.
can talk?
Yes.
Okay. So I'm leaving whenever you're